When we talk about signposting and support, and it's a big piece of the work that we do within organisations, what we mean is that the resources and experts that are there to help you with your own mental health. So signposting could be internal within an organisation. So it could be employee assistance programs, private medical care, other support that might exist within the organisation, or it could be external to the organisation. So it could be your local Mind, your local Calm, it could be useful resources on the internet, it could be books that might be useful, and that that list is continually evolving and growing. And we really encourage workplaces to come up with their own resources around what signposting is right for them within their locality, but also reflective of the makeup of the people that are working with them.
I think one of the true benefits of the workshops that we facilitate is the benefit of signposting, and that's signposting outside of organisations if it's impossible for you to get support inside. And I think we've got the most wonderful array of opportunity now to signpost people to the style of or their preference, and to the way that they would like to disclose or gain support. So it doesn't have to be the workplace. I mean, we're not short of charities and apps and organisations and films and self-help. We're not short of any of those things. But it's about people knowing about them that is the challenge.
Changing attitudes and behaviours around mental health is a journey. It is not put everybody through a programme, tick the list and move on. And so, many of our clients we've been working with now for 2, even 3 years, and we find that their needs really evolve over that time. And our response to that evolves.
There's been a massive change. I remember that we used to be beating on people's doors trying to come in and talk about mental health in the workplace, and now that has reversed. Organisations approach us, are interested in what we've got to say. I remember way back when it was a 2-day programme to talk about mental health awareness, whereas now we could condense that really into 2 hours, because generally there is more understanding around mental health. It's not complete, but it's significantly improved.
Yes, for me, I mean, the big changes within the room that we facilitate is the entrance of the people that attend it comes from a really different place now. And I think a long time ago we were fighting this, and now the hearts and minds are in the right place to actually be able to deliver those key messages in a much shorter time frame. People are really talking about this now. They're really wanting to know. I think there's a hell of a lot of change in the room in terms of knowledge and language and stigma issues. So I think we've got a very different starting point.
I find that people want to talk more in the room and discuss particular issues more. I remember, having silent audiences, and it's really not the case now. We very rarely walk away on time. People want to stay and ask questions, and it's wonderful to be able to do that.